The important changes that occur in the brain in the context of chronic substance use in fact underlie the reason why substances for many people are so difficult to stop. And it is because of what I've referred to as the hijacking of this reward system. So what is the reward system? Well, the reward system is a set of circuits and anatomical structures in your brain that are there to be activated in response to good things that happen in your life. Getting a promotion at work, getting a raise, being intimate with your partner, getting a birthday card, feeling happy by being surrounded by other people. In those situations, the brain releases a very, very small amount of dopamine to say, that's good, you feel good, this is a behavior that you want to repeat. So in fact, our reward system is a very, very primitive part of our brain that is actually very important in terms of us having a full, functional, healthy life. However, when one includes substances into the mix, it causes a release of dopamine that is far in excess of any natural reward that one may get. Meaning that eventually the reward system becomes desensitized to other more natural rewards, and in fact can only be activated by high potency external rewards, which is alcohol and drugs. So when one looks at recovery rates after addictions, it's impossible to not be disappointed. 50% to 66% of patients, so 1/2 to 2/3 of patients, will relapse within the first 12 months after an addiction treatment. Whether it is inpatient or outpatient, it doesn't make a difference, which is very disappointing. However, when one looks, for example, at a condition like diabetes or high blood pressure, 50 to 66% of patients with those conditions will have a relapse or recurrence of their symptoms within the first 12 months after being admitted or hospitalized for those conditions. So in fact, the long-term outcomes of addictions, while being disappointing, are no more or less disappointing than other conditions in medicine. And the reason that relapse rates are so high are several-fold and quite layered and complex, like an onion. You sort of peel back the layers of the onion and you get to the bulb. Essentially for me, as a psychiatrist, as a psychopharmacologist, as a doctor, I look to the brain changes. And while those brain changes take several months to years in order for that system to become hijacked, for that compulsive use to become everything and the only thing about that person, it takes equally as long, if not longer, for things to normalize and to go back to normal. The brain has got a remarkable ability to heal itself. This idea that you don't produce new neurons is a complete fallacy as well. Your brain is actively producing new neurons all the time in a process that we call neurogenesis and long-term potentiation. And the idea there is that by continuing to treat that person after they have detoxed, after they have stopped using, paying attention to the social determinants, paying attention to other recovery-orientated outcomes, to social support, continued follow-up, are ways in which we can improve an individual's retention in treatment, and the longer we retain a person in treatment, the more likely their brain is to completely recover. So yes, it is possible to completely recover from substances, but one must also expect that there will be bumps and potholes along the road. And oftentimes I have people asking me, how many times is it going to take for my relative or my loved one to be well, to be over the substance, to be cured? And I have no answer for those patients other than enough. They need enough times. And when the time is right, and when all of the ingredients and the recipe list for recovery are right, then that person will actualize that.